Adults eliminate about a quart and a half of urine each day. Products are being filtered through your body all day and night. The kidneys are always working to get rid of toxins and waste in your body. We all know that we are not perfect, neither is our urinary tract. Therefore, we are prone to the urinary tract disorder of incontinence. I'm here today to inform my audience of incontinence. I will discuss the etiology, risk factors, clinical manifestations, diagnostic studies, and treatment as it relates to the urinary tract disorder. Urinary incontinence is involuntary loss of urine or uncontrolled leakage of urine. This disorder is more common in the older population and is seen more in women than in men. Physical causes of incontinence include several different problems. Inhibited detrusor contraction involves not being able to contract the bladder muscles correctly. Strictures or obstructions can cause leakage of the bladder. Increased vesical pressure that can happen during pregnancy is also a cause of incontinence. Urethral deformity, altered muscle tone, and immobility are also causes of incontinence, normally in elderly people. Psychosocial causes of incontinence include confusion and decreased vision. People who can't see can't get to the bathroom in time. Narcotics, alcohol, diuretics, and antihistamines cause incontinence as well. There are 5 different types of incontinence. Stress incontinence is the most common and is when small amounts of urine is lost during coughing, sneezing, and lifting. Urge incontinence happens when a bladder contraction happens but is felt as the urge to void. Mixed incontinence is usually more common in older women and is a mix between urge and stress incontinence. Overflow incontinence occurs when the bladder is at its max capacity and must leak to prevent rupture. Functional incontinence occurs when a person is cognitively impaired and cannot void appropriately. However, the anatomy is fine. Involuntary urine loss is the main clinical manifestation. Uterine or urethral prolapse can also occur, which is when the bladder protrudes through the vagina or penile opening. As for diagnostic studies, a urinalysis is done to rule out infection, as infection could be a cause of incontinence. Ultrasounds and catheterization are done to check for post-void residual. Several different methods are used to treat incontinence. Timed or habit voiding, bladder retraining, Kegel exercises, pelvic floor stimulation, all can be used as behavioral therapy for treatment. Pharmacological measures are also used. Anticholinergics such as atropine and antispasmodics such as Bentyl are the first line of treatment for urge incontinence. Tricyclic antidepressants such as Elavil are also used to increase bladder neck resistance. Estrogen, which is a hormone, is also used to increase blood flow and tone pelvic muscles. Surgery is also done for stress incontinence by repairing the vagina or using sling procedures. Overflow incontinence is treated by prostate or obstruction removal. For functional incontinence, the cognitive issues must be dealt with. Patients should be reminded to void regularly and be helped to the bathroom as needed. In conclusion, I have discussed this urinary tract disorder in hopes of better informing my audience of this disease. This disorder can be treated and resolved, but if left untreated, this disorder can have devastating and embarrassing effects. Therefore, knowing more about incontinence can help to catch the disease earlier and you can get the appropriate treatment.